A patient with shallow breathing and cyanosis should be treated first by A. Applying a tourniquet. B. Initiating high-flow oxygen. C. Starting chest compressions. D. Elevating the legs. Answer B. Cyanosis indicates hypoxia. High-flow oxygen is the immediate priority. During a trauma assessment, the C in the primary survey stands for A. Circulation. B. Consciousness. C. Compression. D. Contusion. Answer A. Circulation is assessed to ensure adequate blood flow and detect life-threatening bleeding. Which finding is most consistent with hypoglycemia in an adult patient? A. Warm, flushed skin. B. Rapid, deep respirations. C. Confusion and diaphoresis. D. Hypertension and bradycardia. Answer C. Hypoglycemia often presents with altered mental status and sweating. An EMT arrives at a patient with suspected stroke. The most important initial action is A. Performing a full neurological exam. B. Checking blood glucose. C. Establishing rapid transport to a stroke center. D. Administering aspirin. Answer C. Time-sensitive transport to a stroke center improves patient outcomes. A patient has a weak pulse, low blood pressure, and pale skin. This is most indicative of A. Hypovolemic shock. B. Anaphylaxis. C. Sepsis. D. Hyperglycemia. Answer A. Low perfusion and hypotension suggest volume loss causing hypovolemic shock. Which oxygen delivery device provides the most precise oxygen concentration? A. Nasal cannula. B. Non-rebreather mask. C. Venturi mask. D. Simple face mask. Answer C. Venturi masks allow precise titration of oxygen concentration for respiratory patients. A patient with severe epistaxis should be positioned A. Supine with head flat. B. Sitting upright, leaning forward. C. Lying on the side. D. Head tilted backward. Answer B. Leaning forward prevents blood from entering the airway and allows assessment. During CPR on an adult, chest compressions should be at a rate of A. 60 to 80 per minute. B. 80 to 100 per minute. C. 100 to 120 per minute. D. 120 to 140 per minute. Answer C. Current guidelines recommend 100 to 120 compressions per minute for effective perfusion. Which assessment finding suggests anaphylaxis? A. Slow pulse and dry skin. B. Stridor, hypotension, and hives. C. Headache and blurred vision. D. Flushed skin and mild cough. Answer B. Airway compromise and systemic allergic response indicate anaphylaxis. A diabetic patient is unconscious with a rapid, weak pulse. You should first A. Check for a medical alert bracelet. B. Administer oral glucose. C. Begin CPR. D. Assess airway and breathing. Answer D. Airway and breathing take priority before interventions for hypoglycemia in an unresponsive patient. Which of the following best describes compensated shock? A. Low blood pressure with altered mental status. B. Normal blood pressure with tachycardia and pale skin. C. Bradycardia and cyanosis. D. Respiratory arrest with hypotension. Answer B. Early or compensated shock maintains BP but shows other signs of poor perfusion. A patient presents with chest pain radiating to the left arm and jaw. priority action is A. Obtain vital signs and perform full history. B. Administer aspirin if allowed. C. Prepare for rapid transport and continuous monitoring. D. Start 4 fluids immediately. Answer: C. Suspected myocardial infarction requires transport while monitoring vitals and oxygenation. The main purpose of the sample history is to A. Diagnose the patient definitively. B. Identify life-threatening conditions. C. Gather relevant past medical and present symptom information. D. Replace physical assessment. Answer: C. Sample ensures the provider collects key history without delaying care. Which scenario requires immediate activation of the EMS system? A. Mild sprain with swelling. B. Sudden, severe abdominal pain with hypotension. C. Chronic headache. D. Low-grade fever with mild cough. Answer: B. Hypotension and acute abdominal pain may indicate internal bleeding or shock. A patient shows gurgling respirations during airway assessment. You should first A. Suction the airway. B. Give oxygen by non-rebreather. C. Place in recovery position. D. Begin chest compressions. Answer: A. Gurgling indicates airway obstruction by fluid, suctioning clears it for ventilation. Which vital sign pattern is most indicative of tension pneumothorax? A. Bradycardia, hypotension, and unilateral absent breath sounds. B. Tachycardia, hypertension, and bilateral wheezing. C. Normal vitals with cyanosis. D. Hypotension and slow respirations. Answer: A. Unilateral absent breath sounds, hypotension, and bradycardia suggest tension pneumothorax. When moving a patient with suspected spinal injury, you should A. Use a single arm lift. B. Roll the patient sideways quickly. C. Maintain head, neck, and spine alignment while securing to a backboard. D. Drag the patient by the arms. Answer: C. Spinal precautions prevent further injury during movement. A patient with suspected opioid overdose exhibits A. Hyperventilation and tachycardia. B. Pinpoint pupils, respiratory depression, and altered mental status. C. Hypoglycemia and diaphoresis. D. Hypertension and agitation. Answer: B. Classic opioid overdose signs include meiosis and respiratory depression. Capillary refill time in adults is normally A. Less than 1 second. B. Less than 2 seconds. C. Less than 3 seconds. D. Less than 5 seconds. Answer: B. Delayed capillary refill indicates poor perfusion or shock. The Heimlich maneuver is indicated for a patient who A. Is choking and can speak. B. Is choking with complete airway obstruction and cannot cough or breathe. C. Has mild throat discomfort. D. Has a partial airway obstruction but is breathing. Answer: B. Abdominal thrusts are used only for complete obstruction without effective airflow.